back to the Idea Exchange, where we explore the most pressing health issues of our time and exchange ideas for better future. I'm your host, Wes Piri, and our guest is Vincent Chiremba. In this episode, we are shining a light on a medical emergency that strikes suddenly and can change lives forever. That is cerebral vascular accident, also known as stroke. Every year, millions of people worldwide suffer from a struggle, leaving survivors and their loved ones to navigate a complex journey of recovery and rehabilitation. Join us as we exchange ideas with neurologists. We will delve into the latest advances in stroke treatment, explore strategies for prevention and early detection, and discuss innovative approaches to rehabilitation and recovery. Welcome.
Thank you.
What is a cerebrovascular accident and how does it occur?
A cerebrovascular accident is a destruction and loss of function of part of a brain due to interruption of its blood supply. So this happens when there is a disturbance in the blood supply in the brain, and for the case to be classified as cerebrovascular accident or stroke, the symptoms that result from it, they should last for more than 24 hours. And if it's not 24 hours or less, if it's less than 24 hours, it's called transient ischemic accident, which is also known as a semi or sub stroke.
What are the different types of stroke?
So there are two major types of stroke, ischemic and hemorrhagic. Ischemic, this is when there is reduced blood flow to part of a brain. This can be due to blockage of the vessels or reduced perfusion pressure. So reduced perfusion pressure happens when the blood is not pumping the heart is not pumping blood with enough force to push it to the brain. So the other type is hemorrhagic, and hemorrhagic is when there is damage to the vessels, and this leads to bleeding into the brain or the tissues that surround the brain. There's also transient ischemic accident, which is not necessarily stroke. So this happens when there is temporary damage to the brain due to temporary disturbance in the blood circulation. But clinically, the symptoms do not last for more than 24 hours, so it's not classified as stroke.
What are the common causes and risk factors for stroke?
So generally, as I mentioned when defining what stroke is, it's caused when there is disturbance in blood circulation to the brain. And for ischemic stroke, this can happen when there is an atherosclerosis or thrombosis, when there is thromboembolism, or when there is reduced perfusion pressure. So atherosclerosis or thrombosis happens when there is narrowing to the blood vessels due to buildup of plaque. Thromboembolism happens when there is a clot or any other substance that is generated elsewhere in the circulation and is deposited in the brain. When there is reduced perfusion pressure, as I explained before, is when the heart cannot pump blood with enough force to push it to the brain. For hemorrhagic stroke, this can be due to trauma. That's direct damage to the vessels, hypertension, which can cause rupture of the vessels when the blood pressure is too high, or vascular defects, when there is a defect to the vessels, like when they are not in proper shape and that they can easily be damaged. So in short, those are the causes of stroke, and the following are the risk factors. So we have obesity, diabetes, hypertension, inactivity, smoking, previous heart disease, previous stroke, or transient ischemic accident.
What are the symptoms of stroke and how is it diagnosed?
So for the classical symptoms, we have sudden loss of balance, so the individual might fall. There is sudden visual impairment. They can they find it difficulty to speak. We have face drooping. So this is when the muscles of the face are weak and they tend to like sag. We have visual impairment. So the patient is not able to see properly, and we also have paralysis or weakness of muscles. So for the signs, for the symptoms, I mean, they usually develop suddenly. Like an individual can be normal at one moment, and just moments later they are showing all these signs. And for the diagnosis, it's mostly clinical. So we do physical examinations, and to supplement that, we do imaging, maybe using MRI or CT scans to pinpoint the affected area of the brain and to eliminate other possible causes of the symptoms.
How does stroke affect the brain and what are the potential outcomes?
So stroke damages the brain tissue. This can be permanently or transitionally. That maybe with time the tissue can recover, and when there is tissue damage, it brings about the symptoms I've mentioned, like face drooping, visual impairment, speech impairment, loss of balance. So, as we know that most of the body's activities are regulated by the brain. So when there is the destruction to the brain, the body cannot function properly. Like the muscles become weak and sometimes paralyzed, like they cannot be moved. You have speech disturbance due to weakness and paralysis of muscles around the face drooping as well due to paralysis of muscles around the face, and we have visual impairment. So these are just the classical symptoms that result from damage of brain tissue.
What is the role of emergency medical service in treating stroke?
So stroke is a medical emergency as it starts suddenly and progresses so quickly. So it needs to be addressed as fast as possible to avoid further damage to the brain. So when someone has a stroke and there is a delay of treatment, the brain can be damaged even more, and this will cause worse uh, symptoms and clinical presentation. So clinical medical services will help in managing stroke patients sooner and uh, earlier to avoid further brain damage. So we definitely depend on emergency medical services to help us prevent further damage to brain tissue and worse complications of stroke.
What are the treatment options for stroke, including medication and surgery?
Alright, so for the management of stroke, uh, in emergency settings, they stabilize the patient first and make sure they are in a safe environment because some patients can be convulsing and maybe they can injure themselves. So you have to make sure the patient is stable and they're safe. Uh, you you administer IV fluids to help with restoration of blood volume if in case the patient was involved in an accident. Uh, you can also administer antithrombotic drugs. These are drugs that will dissolve clots, so this will help in case of an ischemic stroke uh, that happened due to a clot lodging in the brain. Uh, you can also do surgery, although not so often. So a surgery can be done to remove blockage and repair vessels. But most importantly, stroke is managed under rehabilitation facilities. So this is where the patients are helped to regain function of uh, affected muscles, and they are helped uh, to be able to walk again in case they were paralyzed, to be able to speak again in case they lost speech functionality. So the most important management of stroke is rehabilitation.
Alright. What are the long-term effects of stroke and how can they be managed?
Alright, so stroke has mostly long-term effects on the body. So it's mostly to do with muscle functionality. So we have a speech and visual loss due to affected muscles of the face. And to manage this, there is rehabilitation training that's done to help the patients gain control of the muscle, the facial muscles, and under the rehabilitation training as well, they help to gain muscle strength. Stroke can also lead to movement defects when the muscles of the legs and hands are affected. In this case, we also depend on rehabilitation facilities. When the muscles of the face, muscles of the legs and arms are affected, we also depend on the rehabilitation centers to help us help the patient recover by uh, physical training and other rehabilitation techniques that will make sure the patient is able to gain muscle strength and muscle control. We also have memory and cognitive defects. So, due to stroke, someone can lose memory and can also lose cognitive abilities. So, for memory, uh, we have therapy and therapy sessions that can be used to help a patient regain memories, and sometimes they're eventually able to get back lost memories, while sometimes they can't really be able to regain the memories they have lost. And for cognitive defects, uh, there is also therapy, especially occupation therapy, that can help one to relearn uh, some cognitive skills and to be able to achieve uh, cognitive state or cognitive level they were at before they had the stroke.
How can stroke be prevented and what lifestyle changes can reduce risk?
To prevent stroke, one will have to prevent the risk factors that makes an individual more likely to develop stroke. I'll go through some of the risk factors and how someone can prevent them, and the lifestyle modifications they have to do in order to avoid that particular risk factor. I'll start with obesity. So obesity is a state of being overweight. So when someone is overweight, they put themselves at risk of developing stroke, and an individual can avoid stroke by avoiding obesity. And to avoid obesity, someone the individual has to be able to manage their weight. So they can do this by doing regular exercises, by monitoring the food they eat, like calculating the calorie intake, and uh, can also be managed. Weight can also be managed by adjusting the diet by including a low calorie diet, and also another risk factor is diabetes. So diabetes is also can also be described as having a higher sugar content in the bread. So another risk factor that puts an individual at risk of developing stroke is diabetes. So this is when there is high sugar content in the bread. So someone can avoid diabetes by adjusting the diet and uh, avoiding risk factors that are associated with diabetes, like hypertension, obesity as well, and the other risk factor that needs to be addressed for one to avoid stroke is hypertension. Hypertension or high blood pressure is one of the major risk factors that contribute to development of strokes. So for someone to avoid uh, hypertension or to reduce the likelihood of developing hypertension, they need to uh, acquire an active lifestyle, so exercising regularly. They can also change their diet. They can also reduce salt intake, avoid smoking and alcohol. So another risk factor would be inactivity. So inactivity is pretty much self-explanatory. So this is when someone doesn't do enough activity; they are sedentary. So inactivity contributes to developing strokes. It's one of the major risk factors to developing stroke. So to avoid that, someone has to simply be more active, to not be so sedentary, to exercise often, going for walks and sports. Another risk factor is smoking, and that is also self-explanatory. To avoid stroke, one has to quit smoking, not just reduce, because it has been shown that almost any amount of smoke can cause a major healthy problems. So on smoking, someone needs to just stop, not necessarily reduce, but stop completely. Another risk factor is heart disease. So to prevent heart disease, uh, someone has to reduce the risk factors that put them at an elevated risk of developing heart diseases. So, for example, they will need to have an active lifestyle. They will need to check their diet and regulate their cholesterol levels. They need to avoid diabetes and hypertension. And lastly, another major risk factor for stroke is previous stroke or TIA, transition ischemic accident. So this is specifically for a patient who has had a stroke before. So when a patient recovers from stroke, that should be a warning sign that they should try their best to avoid another incident from happening, because when they are relaxed and they are not careful, a stroke can can be recurrent, can come back. So for patients and individuals who have had strokes before, they need to make sure that they follow all the lifestyle modifications I've mentioned before to avoid developing strokes. So those lifestyle modifications would be uh, exercising regularly, uh, managing weight, uh, diet, quit smoking, reduce drinking, and reduce hypertension. Not reduce hypertension, reduce the risk of developing hypertension. Yeah.
What is the impact of stroke on cognitive functions and memory?
Alright. So as mentioned already, stroke affects the brain, and we know that the brain is also responsible for storage of memory and cognitive function. So when there is damage to the brain, to the parts that are involved in cognition and memory, the patient can experience cognitive deficit, that's reduced cognitive ability, and if it involves a section of the brain that is involved in memory, a patient can lose some memory. Yeah.
How does the stroke affect emotion and mental health?
Uh, stroke usually affects an individual's emotional and mental health. So this is due to a lot of reasons. To start with, basically, when someone is not well, when someone is sick, especially for patients with chronic conditions such as stroke that has a long recovery period, they tend to be worried about their well-being, and this can bring about anxiety and depression. Uh, Also, when someone has a stroke, they have physical impairments. So these physical impairments can affect the face and uh, make the face look different, and these can make a patient less confident in the way they look, and affect the personal image and confidence level. This can bring about also uh, depression and affect emotional health. Uh, Also, stroke makes some individuals not able to perform tasks which they used to. So these could be tasks that maybe they did for fun, like maybe sports and uh, going on hikes and going to the gym. So these activities can be used to manage stress and depression. But for patients who have had a stroke, they can they can they cannot be able to. Some of them cannot be able to perform these tasks, and this can make them depressed and anxious. Also, some of the patients who have suffered from a stroke, uh, they are not able to work properly, so they may need to take a break from their work and also other social and community gatherings. So these can lead to them being alone most of the times without the comfort of their co-workers or their friends. So this can trigger a feeling of loneliness, which is which is implicated in uh, emotional and mental health.
What are the benefits and risks for thrombolytic therapy in treating stroke?
Alright, so thrombolytic therapy or thrombolytic drugs, these are drugs that are used to break clots. Uh, in case of ischemic clot, specifically the ones that are caused by uh, a thrombus breaking the vessels in the brain, the thrombolytic therapy or thrombolytic drugs can be used to dissolve the clots and restore uh, blood perfusion. So this can help in treatment of uh, ischemic stroke specifically, and can improve the symptoms and improve the recovery time. On the other hand, because the drugs dissolve clots, the patient is at risk of bleeding out in case of an accident. So these particular patients can bleed out significantly when they're involved in an accident, or even a cut that could have been easily managed in a patient who is not taking the thrombolytic drug. But for these particular individuals, even a minor cut can lead to bleeding out, and it's also contraindicated in patients with hemorrhagic stroke. So, as I mentioned, patients with hemorrhagic stroke, they have bleeding in the brain or the surrounding tissues already. So, when you administer thrombolytic drugs or thrombolytic therapy, they can worsen the bleeding. So the bleeding will keep on going, and this can bring other complications like raised intracranial pressure, can worsen the symptoms of stroke. So although it's beneficial in treating ischemic stroke, there is also a risk of worsening hemorrhagic stroke, and it also brings about risk in developing other conditions involving blood vessels elsewhere.
How can stroke patients maintain independence and mobility?
So to maintain independence and mobility, the shortest answer would be they need to go under rehabilitation. So rehabilitation helps them to be able to regain function and to be able to function as a normal person would, and it's dealt with it's dealt with in rehabilitation centers under physiotherapists, occupation therapists, there are speech therapists, and other types of therapists. These individuals are trained specifically to help patients to be able to regain functionality. Not only stroke patients, but patients who might have other neurological or neurological conditions or conditions affecting the muscles.
What is the role of rehabilitation in stroke recovery?
So as I've mentioned already, rehabilitation will help the patient to regain functionality, to be independent, to be able to do things on their own, like to be able to cook, to be able to bath themselves, to clean themselves, and it can also help for a patient to be able to recover memory and to recover from cognitive impairment, to be able to get to regain cognitive functionality.
What message would you like to convey to our listeners about stroke awareness and prevention?
So, to our listeners, I would like to let them know that stroke is preventable, and there are lifestyle changes which are not so hard to do to avoid stroke, including diet, exercise, and managing other conditions like hypertension, diabetes, and obesity. I would like to encourage them to pick up healthier lifestyles to avoid stroke and other conditions. And I would like to also let them know that uh, they should trust the system. Uh, they should trust that they can be able, they can be helped under the systems. They should also uh, be aware that uh, stroke can be managed and treated effectively, and they should also have a positive attitude towards patients with stroke, so as to help relieve the uh, emotional and mental health burden on them.
All right, thanks for your time.
Thank you.